Hi everyone, Alexander Andorff here. I recently did an episode about this in Norwegian, but a lot of my followers, they speak English, so they asked if I could do it again, but this time speak English, so I thought, yeah, why not? Basically, we're going to talk about fibromyalgia and some new advances in research. Um, Basically, this will be kind of like an episode-based video here on YouTube and other platforms where we go through new relevant research. Basically, we go through the abstract, maybe the methods and the results. It's all a bit of an introduction to the different studies, just so that you can dive in deeper into the other studies if you find anything interesting. So it will be from 2024 in this episode. We might mix and match, in other episodes, but these 5 studies are all quite fresh, at least when I'm speaking right now. So we're just going to go ahead and talk a little bit about the research we're going to be speaking about. They're all collected from PubMed, and used relevant search terms to find them there, and set the time to 2024, as no research before 2024 is included in the studies. Like I said, we will be providing links in the video description below this video. And basically, there's a lot of studies out there. We just chose 5 studies a bit at random this time, mainly because they look interesting or that they were a bit, eye-catching. For example, we're going to start it off with a study about how earthquakes affect people with fibromyalgia, and also it's going to be a comparison about if they're on medication or not, and how the stressful events affect them. A little bit about me. My name is Alexander Andorff. I got a master's degree in chiropractic and a bachelor in health science. I also work now for 14 years in clinical practice, a lot with diagnostics and physical treatment, but also rehabilitation therapy. You might see on this channel there's hundreds of videos with training programs and exercises for relevant and different conditions, which I put out over the years. That sort of underlines my interest in prehabilitation and rehabilitation, and also prevention of pain, and just providing free training programs to the public, in hopes that can be of relevance and use to improve public health. And yeah, got some good feedback there, so that's always nice. So if you got time or you want to check out those videos as well, just feel free to do that. Yeah, just send me a message or anything if you want specific videos. We're gonna make some more in the near future there, so just look me up there. Yes, as you see, this is I work at Lambertseter Kiropraktisk Center in Fysterbry in Oslo, Norway. We're part of the Vondtklinikkene Tverrfaglig Helse, which basically means it's a mix of chiropractors, physiotherapists, and other relevant health personnel there. And you can see our clinic locations in the video description via link there. Yes, so the first study is called The Effect of Earthquakes on Fibromyalgia, a comparison of patients on medications and without medication. So like I said, this study is fresh off the press, so to say. It's published in July 2024. It's 1st of July today, so yeah. It was published in Rheumatology International, and they were doing a comparative study there, led on by Ostork et al. And the intro goes like this: stressful events like earthquakes might worsen the symptoms of fibromyalgia. As we know, stress can be a factor that stresses the central nervous system, which might increase pain, susceptibility, and sensitivity, which we know is a relevant factor in fibromyalgia. Continue on. Although the influence of medications on these consequences is yet uncertain, the objective of this study was to examine the influence of an earthquake on the symptoms of fibromyalgia and evaluate the impacts of medications used to treat fibromyalgia on the clinical picture. First, I'm not sure where and how they did that, but yeah, they did this before and after an earthquake, so it must be a quite earthquake-ridden area. Yeah, like I said, before and after the earthquake, they did clinical evaluations using different questionnaires and measurement scales. This included FIQ, Fibromyalgia Impact Questionnaire, the HADS, which is the Hospital Anxiety and Depression Scale, and JSS, which is the Jenkins Sleep Rating Scale. And then they did statistical analysis comparing this data and the scores before and after the earthquake to evaluate the differences between the groups. And they found statistically significant increases in the FIQ, HADS, both in anxiety, depression, life quality, in the different medicated and the non-medicated group. For example, the non-medicated group reported significantly higher, changes after the earthquake, with increased anxiety, increased depression, and also worsened sleep quality, also worsened life quality. So it's quite interesting how this stress from the earthquake seemed to have worsened a lot of factors relevant to fibromyalgia. And I think you can sort of apply this to general life as well, with stress in everyday situations, physical stress, chemical stress, and psychological stress, and how that stresses the central nervous system in this chronic pain syndrome. So quite interesting, actually. So the conclusion in the study was that this study highlights the substantial impact of earthquakes in fibromyalgia patients. They also said that medication use may assist in reducing the detrimental effects of stresses like earthquakes on fibromyalgia symptomatology. Earthquakes, that's quite a stress factor, so I'm not sure how you can compare that to like everyday life stresses, but it's interesting though, and they underline the need for future research with larger sample sizes and more extended follow-up periods, basically, to explain these findings and optimize treatment regimens for fibromyalgia patients who experience significant stresses. Going to move on to the next study, study number 2, Hypocapnia in women with fibromyalgia. This is a Nordic study. It was published in the Scandinavian Journal of Pain by Jonsson et al. June 2024. So a very fresh study there as well. Basically, what they wanted to do was to investigate dysfunctional breathing in patients with fibromyalgia by doing blood tests and examining acid-base balance, and then comparing it with healthy controls without the fibromyalgia diagnosis. So quite an interesting study, basically, because we know that impaired dysfunctional breathing can lead to buildup of lactate in the muscles, etc. Quite interesting. Let's have a look. So the method of this study was that they involved 36 women with fibromyalgia and 36 healthy controls in the group. So 72 participants, actually. I think I might have written 36 later, but it's actually 72. And they matched them according to age and gender, just so they were comparable. Then to evaluate the acid-base balance, they took blood samples from the arterial blood samples from the radial artery in the arm. Then they measured carbon dioxide, oxygen, bicarbonate, base excess, pH values, and lactate were analyzed, and then compared between the two groups. And blood gas analyses were performed stepwise on each individual in the study to detect any acid-base disturbance, which was categorized as primary respiratory and possible compensation indicating chronicity. And then the researchers did a three-step approach, and this was used to evaluate the pH, the carbon dioxide, and bicarbonate in this order. And just when I talk about these values later, I just want to indicate that these, you see, P0013 means that it's below 0.005, means that it's statistically significant, means that it's probably true. Basically, that's what it means. A p-value measures the probability of obtaining the observed results, assuming that the null hypothesis is true. The lower the p-value, the greater the statistical significance of the observed difference. A p-value of 0.05 or lower is generally considered statistically significant, which translates that it's probably true. Basically, it's highly likely that it's true. When they did these blood samples, they found that women with fibromyalgia had significantly lower carbon dioxide pressure and higher lactate values compared to healthy controls at the control group. There were no significant differences in oxygen pressure, bicarbonate, pH, and base excess. Employing the three-step acid-base analysis, 11 individuals in the FM group had a possible renally compensated mild chronic hyperventilation compared to only 4 among the healthy controls. And if we go back to seeing on these results, we have higher lactate. And a lot of people with fibromyalgia, they complain about their muscles tiring out quicker, which could also happen if you have higher lactate values in the muscles. So that's quite interesting, or in the blood, I mean, because lactate increases, the lactate increases in the cells when there is a lack of oxygen. For example, if you train under anaerobic conditions, there will be increased lactate or hypoxia. And basically, what it can indicate is that there's impaired circulation. For example, a lot of runners, they measures, like Jakob Ingebrigtsen and similar, they measure lactate during their training to prevent too high lactate levels. Basically, this is for to optimize their progress and etc. Conclusion. In the study, we could identify a subgroup of individuals with fibromyalgia who may be characterized as mild chronic hyperventilators. The results might point to a plausible dysfunctional breathing in some women with fibromyalgia. And here I know I wrote only 36 participants, but it's 72. But yet again, that makes it a lot better. So should be repeated with a bigger patient sample, yes. But 72 is quite okay. Anyway, quite interesting because a lot of fibromyalgia patients suffer from sleep apnea and what seems to be dysfunctional breathing. And some other studies have indicated that lactate and hypoxia occurs with certain subgroups of fibromyalgia patients. This could, of course, contribute to the fatigue and muscle soreness and generally feeling of being tight in the muscles, etc. And muscles tiring quicker. So very interesting study actually. Study number 4. We're going to go down to more of a molecular level in the central nervous system. The study is called The Role of Mitochondrial Dysfunction and Biogenesis in Fibromyalgia Syndrome. Molecular mechanism in central nervous system. This study is also very fresh, studied and published in June 2024 in the molecular basis of disease. And Marino et al., you see the researchers there, a lot of Italian names there. Basically, they wanted to look at the mitochondrial dysfunction in the pathogenesis of fibromyalgia. And as some of you might know or not know, the mitochondria, they are like the cell's power plants. They provide vital energy for the cells and other functions to operate normally. And if you have mitochondrial dysfunction, this could lead to a lot of symptoms actually. And they also underline in the intro here that fibromyalgia is a chronic pain syndrome characterized by neuroinflammation and impaired oxidative balance in the central nervous system. When you talk about oxidative balance, you often talk about free radicals and oxidative stress, you know, which could be addressed with antioxidants, etc. We're not going to talk about the free radical theory now, but maybe another time. Basically, what they said is that this mitochondrial dysfunction leads to a vulnerability to neuroinflammation, increased inflammation in neurons and the nervous system, and also impaired neuronal plasticity. That means the nervous system's ability to change and adapt to certain situations and damage. This has been described as consequences of mitochondrial dysfunction. Another study from 2013 underlines the following. Chronic fatigue syndrome, CFS, and fibromyalgia, FM, are characterized by persistent pain and fatigue. It is hypothesized that reactive oxygen species, ROS, caused by oxidative and nitrosative stress by inhibiting mitochondrial function can be involved in muscle pain and central sensitization, as typically seen in these patients. That's quite interesting. Just a quick comment on the last one. If they're able to sort of isolate this mitochondrial dysfunction and how that affects fibromyalgia patients, maybe they can use that information to make new treatment approaches. That would be very interesting. Anyway, we're going to move on to something called S100 proteins. The study is called A New Frontier in Fibromyalgia Research. So they're going a bit. Basically, this was a fresh study as well, published in May 2024 in the Molecular Brain. The main researcher there was Maria Teresa Vega Ramirez and her crew. And they wanted to look at if the S100 proteins could be used sort of as a biochemical marker in maybe diagnosing fibromyalgia or similar. Basically, fibromyalgia is a chronic condition that causes widespread pain, fatigue, and other symptoms that significantly affect quality of life. The underlying mechanisms of fibromyalgia involve both the immune system and the central nervous system. It has been proposed that changes in multiple ascending and descending pathways in the central nervous system may contribute to increased pain sensitivity in individuals with this condition. So basically, as we know from other research, there's a lot of research out there which indicates that the central nervous system is hypersensitized in fibromyalgia, which might lead to certain known symptoms such as allodynia and hyperalgesia. S100 proteins are proteins, basically a group of small molecular weight proteins involved in inflammation and various functions inside and outside of the cells. And they may play a critical role in the development and progression of fibromyalgia, according to these researchers. Although S100B has been the most studied in fibromyalgia before, other studies have reported that S100A7, S100A8, S100A9, and S100A12 may also be useful as potential biomarkers or for a deeper understanding of the fibromyalgia pathophysiology. And just want to quick detour there about there has been certain DNA testing and research as well, which indicate that some DNA codes and similar might be linked to worsened conditions in fibromyalgia, or even a higher chance of getting it. That's for another episode though. Basically, the role of these S100 proteins in the pathophysiology of fibromyalgia could be mediated by different mechanisms, which, cutting it short, might release pro-inflammatory cytokines, thereby producing inflammation, fatigue, and chronic pain characteristic of fibromyalgia. To gain new perspectives on targeted therapeutic approaches, it is crucial to understand how S100 proteins could impact the pathophysiology of fibromyalgia. So basically, it's a good study, and they have some really good points. And if they could get to the bottom of this, with S100 proteins, hopefully that could lead to a deeper and better understanding of fibromyalgia and the pathophysiology behind this chronic pain syndrome. Basically, we're going to look at connective tissue massage and how, if that might be of help to patients with fibromyalgia. And basically, the connective tissue, it's the tissue that sort of keeps everything together or keeps things apart. And you have specific types of massage techniques to address this connective tissue. So, this study was published in April 2024 in the Journal of Bodywork and Movement Therapy. The main researcher was Bilge Basaki-Salik, and it had his crew there. The aim of the study was to examine the effectiveness of clinical Pilates exercise and connective tissue massage in individuals with fibromyalgia on pain, disease impact, functional status, anxiety, quality of life, and biopsychosocial status. And as you can see, they didn't only look at connective tissue massage, but they also implemented clinical Pilates exercises. So they took 32 women were included in the research study, and they randomly divided them into two groups. One of them got connective tissue massage plus clinical Pilates exercises, and the control group only had clinical Pilates exercises. Then they evaluated the number of painful regions with the pain location inventory. They used the fibromyalgia impact questionnaire to see disease impact, and they also used the HAQ to address functional status. And they also evaluated the quality of life and anxiety with Beck Anxiety Inventory and the short form 36, and the BETH-EBQ to analyze biopsychosocial status. Then they used these to do evaluations before and after the treatment. They got a lot of treatments actually. They had 3 treatments a week for 6 weeks. So they actually had 18 treatments over 6 weeks. So, hopefully that should have an impact. And when we look at the results, we see that the pre-treatment and post-treatment results are analyzed. They were significant in the pain location inventory. You see the pain location inventory went down. We had an improvement in the FIQ and also in the quality of life and mental components. Because it's below 0.05 in the p-value, so definite effect there. Why not get some connective tissue massage, mix it up with some exercises, Pilates exercises or similar that go well with your condition and your current health, because it can be, seems concluded by this study, it can be effective in reducing the number of painful areas in addition to the positive effects of clinical Pilates exercises in women with fibromyalgia. So that's good. Yeah, so we come to the end of this little review of these 5 studies. We're going to do more of these because we got some good feedback from our Norwegian followers. Super cool that the English followers also have contacted us and asked us to make an English edition, and we would love to hear from you. If you watched this and you liked it, please comment and like the video, that'd be great. And also subscribe, because we just want to know if you would like us to keep doing the English versions as well of these, and then if so, that would be great if you give us a little thumbs up or a positive comment below the video, and also if you want to follow us in social media. Yeah, you can follow the clinics and me or both. That'd be great. Okay, so take care, and I hope you enjoyed this episode. So adios.